axillary lymph nodes. There are about 20 to 30 nodes arranged into 5 main groups. First, anterior or pectoral group drains the anterior chest wall and major part of the breast. Second, posterior or subscapular group drains the posterior trunk. Third, the lateral group is responsible for drainage of the upper limb. Fourth, central group receives lymph from all other groups and passes it to apical nodes. Finally, the apical or infraclavicular group, located deep to clavipectoral fascia, drains into subclavian trunk on the right and thoracic duct on the left. Clinically, these nodes are very important in breast cancer, especially sentinel lymph nodes, which are first to receive metastasis. Enlargement may also occur in infections leading to axillary abscess.